Hi, my name is Dan Romerman, and I'm going to educate you on everything you need to know about Medicare in 15 minutes. So get out your stopwatches. Here we go. First off, Medicare is broken up into four main parts: Part A, Part B, Part C, and Part D. Part A is called your hospitalization benefits. Part A is, generally speaking, free for 99.9% of all Americans. You're entitled to this because you worked your whole life, or your spouse has worked, and you get it through your spouse. Part A is your hospitalization coverage. Part A covers everything but this $1,408 deductible that you could potentially owe every 90 days that you go into the hospital. How does that work? You're in the hospital in January with a kidney stone, you owe $1,408. You're in the hospital in April with a gallbladder attack, that's another $1,408. You're in the hospital again with a broken leg in September, let's say you're in there for 120 days. You owe another $1,408 deductible, and then when you hit day 61, you will start owing $352 a day until you hit the 90th day, and then at the 91st day, you would owe $708 a day. So, obviously, there's a bunch of holes in Medicare, okay? But that's why you take out a supplement. The supplement plugs the holes. The most popular supplement is known as Plan G, okay? We're going to talk about Part B of Medicare now. Part B is considered your outpatient medical coverage. Part B is not free. For 99.9% of Americans, they will pay $144 a month for your monthly Part B premium. Everybody in America pays this. Now, if that creates a financial hardship on you, sometimes as a qualified Medicare beneficiary, you might be able to get your Part B premium paid for if you're lower income. That's something we can look at in a case-by-case scenario. But the way Part B works is like this. You have a calendar year deductible of $198 that you have to meet before you start to have any Part B benefits. Once you meet your calendar year deductible, the government pays 80% of all your medical expenses. So how does that work? Well, let's say you have a $100,000 chemotherapy cancer claim. The government pays 80% of that. You're responsible for 20%. 20% of $100,000 would mean that you would owe $20,000. Once again, that is why most people will take out a supplement plan. The supplement plugs all the holes. Your Part A out of pocket and your Part B out of pocket. If you're keeping this simple, if you take out the most popular Medicare supplement plan, also known as a Medigap plan, Plan G, your only out of pocket for the year would be $198, which is your Part B deductible. A Plan G will run you anywhere between $110 to $140, $150 a month, depending on where you live. Okay? So, if you're with me so far, you would have, through the government, Part A, Part B, there's a bunch of holes that Medicare don't pay for. You plug those holes with your supplement Plan G, okay? What's not covered yet is Part D, prescription medicines. This you'd have to take out separately. So, what Part D is best for you, we really don't know until we get in there and we really dig deep, okay? Some people we talk to are on no medicines. Some people we talk to are on 15 medicines. What plan is going to be best for you? Because normally when we look at Part D plans, There's about 28 plans to choose from. All the major companies write Part D plans. You have United Healthcare, you have Humana, you have Aetna Coventry, you have Cigna, Anthem Blue Cross Blue Shield, Allwell. What plan's best for you? We really don't know without doing a deep dive. Because prescription drug plans run anywhere between $13 a month and $100 a month in premium. Okay? Most people can get away with the cheaper $13 a month plan. But if you're on 15 medicines, you might have to, the premium might be $100 a month would be your best option. Okay? We really don't know. But one of the nice things is that if you contact our office, we will do that, all that examination for you. You know, what's your daily dosage? What's your milligrams? Is mail order a better option for you? Okay? There's 5 tiers of medicines when it comes to prescription medicines. Tiers 1 through 5. You have preferred generic, preferred brand name, and then specialty medicines. Tier 3, Tier 4 medicines can be $47 copay, can be $100 copay. It can even be 33% on a Tier 5 of the cost of the medicine. You've heard of the donut hole before. How do you get to your donut hole? It's what you pay and what the carrier pays. So, as an example, it's $100 a month medicine. You pay a $47 copay. The carrier pays $53 a month. That total $100 goes towards your $4,020 calendar year out-of-pocket maximum, and then you fall into the donut hole. Okay? So really, what Part D plan is best for you, I really have a hard time saying. But I can tell you this, okay? For most people that have a lot of utilization, going with a standard Medicare Part A, Part B, with a supplement and standalone Part D makes a lot of sense, okay? What's your premium cost? Well, your Part B is a consistent $144 a month. Everybody in America pays that. Plan G, let's just say the average premium is $140, and then your Part D, let's just say your premium is $20 a month. That would give you a total monthly premium cost of $304 a month. Your only out-of-pocket on the medical would be your Part B deductible of $198, and then we'd have to figure out what your prescription drug utilization is and what your costs are here. If you're on Tier 1, Tier 2 medicines, which are all your generic, there's a very good chance you have $0 out of your pocket with a $13 a month prescription drug plan. Okay? This just needs to be analyzed case by case. It's all based upon your personal utilization of prescriptions. Okay? Very hard to cover prescriptions in a 15-minute video, but you get the general gist of it. So, let's move on. We're going to call what we just covered, by the way, Option A, or Option 1. Once again, Part A through the government, Part B through the government, Medicare. You can go to any doctor, any hospital that you want. Your supplement plugs all the holes. If you had a $1 million claim, the most you would owe, if you have Part A, Part B, and a Medicare Supplement Plan G, is $198. Your Part B deductible, that's it. Really don't overthink it. That's what your out-of-pocket is. And then you need a standalone Part D. We're going to call that Option 1. Option 2 would be what's known as an MAPD. It's also known as a Medicare Advantage Prescription Drug Plan, also known as a Part C. These are also known as free plans or $0 plans. Why are they free? Why are they $0? Everybody asks. Let me educate you. Because everything happens behind the scenes. A Medicare Advantage plan is sponsored by a major institution such as United Healthcare, Humana, Cigna, Aetna Coventry, Essence, Allwell. We're licensed with them all here at Greenway Insurance and Financial. Whether you're looking at a Medicare Supplement, Medicare Advantage, we can look at them all. A Medicare Advantage plan, when United Healthcare or one of these companies enrolls you into the plan, They're paid by the government. That's how they're able to give it to you for free. So, or $0. That's what's happening. Now you got to use their doctors and hospitals in the network. Now there's lots of different plans to choose from in the world of Medicare Advantage. HMO, PPO, POS. We're only going to look at an HMO really quick. Okay? So the way these work, you have a $0 deductible, but you have an out-of-pocket maximum. Okay? This is like having your Medicare Part A, Part B, your supplement, and your Part D all rolled up into one plan, hence Medicare Advantage Prescription Drug Plan. So, when you go to your primary care doctor, it's normally a $0 copay. You pay nothing. You go for preventative care. You pay nothing. You go to the specialist. It's a $35 copay, $40 copay, or $45 copay, depending on the plan. Urgent care, $30 copay or $40 copay. Emergency room, $90 copay or $100 copay. If you're hospitalized overnight as a bed patient, it could be a $280 copay, a $320 copay per day for 7, 8, 9 days, depending on what plan you go with. If you have same-day surgery, it's a $225 copay or $250 copay, depending on the plan. If you go and have a major outpatient test, like a CAT scan, MRI, ultrasound, $75 copay. Every time you pay your copay, it goes towards your out-of-pocket maximum. Most plans hover right around $2,900 out-of-pocket maximum. So, $0, but potentially a lot more exposure than just the traditional Medicare supplement, Part A, Part B option. But that has a fixed cost. What you save, because you're always paying your $144 a month for your Part B, what you save is your supplement premium, let's say $140, and your Part D premium, let's say that's $20. You save $160 a month by taking out a Medicare Advantage plan. Okay? But in exchange for that, you have a $2,900 out-of-pocket maximum, and you got to use the provider's network of doctors and hospitals, which is normally very extensive. Most of these Medicare Advantage plans have very broad networks, doctors, hospitals. UnitedHealthcare has a national PPO network. Essence is more like a regional PPO network. So it really just depends on, network. So it really just depends on what carrier you look at. All these plans on the Medicare Advantage plan, they all have these benefits built in. Dental normally comes standard with every Medicare Advantage plan. So your 2 cleanings a year, your bio x-rays, checkups, maybe even cavity fillings, all paid for 100%, normally with no copay, up to 2 times a year for your basic cleanings and checkups. Also major restorative, a lot of times up to $1,000 per calendar year per person. So if you need dentures or bridges or partials or plates or even a crown, they'll pay up to $1,000. Most of these plans now have that built right inside the plan. Vision. So vision wear. Your eye exam normally is a covered benefit, and then up to, let's say, $130 to $150 every 2 years for eyewear, contact lenses, and frames. Also built right inside the plan with paying nothing. Over-the-counter essentials. All these plans started adding an additional coverage of, let's say, $50 to $100 every 3 months for over-the-counter essentials. Vitamins, mouthwash, toothpaste, Band-Aids. You get a little 16-page catalog, and you get to order $50 worth of stuff that's medically related, and you get it delivered right to your front doorstep. Very cool little benefit, and all these plans have it. And then you've heard of Silver Sneakers before. Silver Sneakers is the gym membership that's built right inside most of these Medicare Advantage plans. Some plans have their own gym membership provider network, but most of the time, like your local YMCA, we have to do a provider search to make sure that your favorite gym would be part of the network if that's important to you. But you might be able to save $20, $25 a month by having your gym built in the plan here. So Medicare Advantage plans are very, very prominent in the metropolitan areas. When you get out to the rural areas, you're going to find that your Medicare supplements maybe are a little bit more prominent, just because the plans don't tend to be as good in the rural areas as they are in the metropolitan areas. So, this being said, folks, here at Greenway Insurance and Financial, we've been in business for 30 years. You can find us on our website, www.greenwaysave.com. Feel free to call us at 636-922-4617, 636-922-4617. Been in business for 30 years. We have lots of agents here at the office here that can help you with years of experience. Feel free to check us out now or review us now. You'll get on a landing page, and folks, you can send us to your doctors, send us your prescriptions that you're on. We'll do the deep dive, make sure that your doctors are in the network. If you're looking at a Medicare Advantage plan, we'll shop around your Medicare Part G or your Plan G for you with the 20 different companies that we're licensed with. So, folks, we'd love the opportunity to work with you. Thank you, and have a good day. Bye.